Hello everyone, my name is Dr. Hong Li, Associate Professor in School of Nursing at the Azusa Pacific University. It is my honor to present this study titled Perceived Self-Efficacy Among Parents Caring for Children with Autism in Middle Childhood. This research study was conducted in collaboration with Ms. Batia, who is a master's student in Applied Stats and Data Analytics, and Dr. Doctoral, Professor of Nursing. This study was supported by APU Faculty Research Grant. Autism Spectrum Disorder, or ASD, is a complex neurodevelopmental disability that can cause a wide range of impairments in the social, learning, communication, and functioning aspects of people's life. ASD affects people at all stages. However, the symptoms are commonly identified in early childhood, between 3 to 4 years of age. In the United States, the prevalence of ASD in childhood has been steadily rising in the past 30 years. According to CDC, in 2018, about 1 in 44 U.S. children aged 8 years has an ASD. Caregiving responsibilities of their parents may include monitoring conditions, interpreting behaviors, providing hands-on care, making decisions, managing and maintaining health in the home, developing care routines, time management, and problem solving. To achieve effective caregiving, these parents often need to reorganize their daily lives to support their child's specific needs, reduce hours of work, or even leave the workforce to become a full-time caregiver. These caregiving-related burden may increase their burnout, sense of uncertainty, loss of quality of life, or even chronic sorrow. These parents are also at a higher risk for physical health problems. Therefore, our understanding of how these parents appraise their parental stress and self-efficacy may provide pathways for improving their health and well-being. This study aimed to outline the predictive pathways between children's ASD-related health conditions and their parents' self-appraisal of stress and efficacy. This study specifically focused on children between age 6 and 11, which is considered middle childhood. This study used Lazarus' classic transactional model of stress and coping as the theoretical framework, which includes linear pathways between 3 core components: appraisal of stressors, coping efforts, and coping outcomes. Informed by the empirical findings from the literature and applying and expanding on Lazarus' model to the population of parents caring for children with ASD, this particular study emphasized on the process model between the external stressor, parents' primary appraisal of the stressor, and their secondary appraisal of psychological, social, and material capacities that they have when taking care of their children. To achieve such a goal, we used the 2019 to 2020 U.S. National Survey of Children's Health data to conduct a retrospective cross-sectional secondary analysis. Beginning in 2016, the NSCH collects yearly information related to the physical health and emotional well-being of U.S. children 0 to 5-year-old, 6 to 11-year-old, and also 12 to 17-year-old. The collected information includes access to and use of healthcare, family interactions, parental health, school and after-school experiences, and neighborhood characteristics. The NSCH oversamples children with special healthcare needs, including those with ASD. Because the sole data source of this study is de-identified case-level data for public use and did not involve data collection with human subjects, an exempt status was approved by APU IRB. More specifically, the following data was retrieved for children aged between 6 and 11 that had a current ASD diagnosis: ASD severity, child general health, parental self-efficacy, and parental stress self-reported ratings. and then collected data was analyzed in SAS and JUMP. Specifically, in the current study, children's general health was measured by, in general, how would you describe the child's health on a 5-point Likert scale ranging from excellent to poor. Children's ASD severity was measured by, does this child currently have autism or autism spectrum disorder? If yes, is it mild, moderate, or severe? Parental self-efficacy was measured by, how well do you think you are handling the day-to-day demands of raising children on a 4-point scale, ranging from very well to not well at all. The perceived parenting stress was measured by 3 questions. During the past month, how often have you felt? 1. That this child is much harder to care for than most children their age. 2. That this child does things that really bother you a lot. 3. Angry with this child. All these 3 questions were rated on a 5-point Likert scale, ranging from never to always. In analyzing the data, it was found that in 2019 and 2020, a total of 694 U.S. children aged 6 to 11 had a current diagnosis of ASD. 49% of them reported mild severity, 40% of them reported moderate severity, and 11% of them reported severe ASD. And all these children are kind of evenly spread across the age range. Results from the descriptive analysis found that the average rating of the general health of these children was 2.04, indicating a very good health. Their parents reported an average self-efficacy score of 1.7, which is significantly lower than the neutral point of the Likert scale, meaning they felt that they are handling the demands of parenting very well. The self-reported parenting stress also showed that these parents did not often feel the stress of the ASD child being harder to care for, bothering them, or being angry at the child. To examine the correlations between these variables, Spearman's correlation was measured for autism severity, an interval variable, and all other variables, while Pearson's correlation was run between the rest of the variables. The correlations revealed that health and stress was significantly associated with all the variables. ASD severity and parental self-efficacy was significantly related to health and stress, but the 2 variables were not associated with one another. To further examine the predictive relationship between children's health-related stressor and parental stress appraisals, a path model, as shown on this slide, has been tested in JUMP. The results reveal that children's general health status and severity of ASD are significant predictors of parental stress, which in turn predicts 24% of the variance in parental self-efficacy. The model's goodness of fit indices also show that this proposed model fits the dataset very well. Based on the findings of this retrospective secondary data analysis, it was concluded that between 2019 and 2020, 3.1% of U.S. middle childhood children had a current ASD diagnosis. This is comparable to the reported prevalence in the literature. Also, despite having a current ASD diagnosis, over 70% of these children were reported as having excellent or very good general health. Moreover, the actual impact of having a child with ASD on parents' self-appraisal of caring for the child is mediated by parents' primary appraisal of the stressor. Overall, children's general health status and severity of ASD jointly predict parental stress, which in turn predicts 24% of the variance in parental self-efficacy. Further studies along this line of research could explore other mediating and moderating factors of parental stress appraisals, such as family dynamics and emotional support. Such understanding could further inform the design of effective well-being interventions for parents and caregivers who struggle with caring for children with ASD. Key references are shown on this slide. Thank you for taking the time to listen to this presentation. Please do not hesitate to contact me at hli@apu.edu if you have any questions, comments, or suggestions for future research.